Hi everyone. Today we are going to discuss about the medical coding training. Medical coding training has a huge demand in the market due to the aging population and COVID-19 pandemic. So today we discuss about the medical coding training, the scope of medical coding, and the jobs in medical coding. Objectives of today's training: we discuss about the what is medical coding, the scope of medical coding, and the CPC board exam, medical coding jobs, international and work from home opportunities, and also next steps, what to do further to get a job in medical coding. And we are proud to say that medicine is one of the best healthcare brands to watch in 2021, awarded by the business stalwarts. So, medicine, we provide comprehensive medical coding training and placement assistance throughout the India and also globally. And we provide assistance for work from home. Medicine Healthcare Solutions. The CEO is Dr. Santosh Kumar Gupta. He is a world record holder with the 45 certifications and 15 years experience. It is featured in the Forbes magazine as a Pride of India. Medicine started in the year 2009 and trained more than 10,000 coders since 12 years. And all medical coders got certified and placed in MNCs. We we leverage our experience and expertise and we empower the students to become a skilled medical coder and get them certified and get job nationally and internationally. We'll help the medical coders to get the job and work from home. So what is medical coding? Medical coding is nothing but transformation of healthcare record into medical codes, especially diagnosis, procedures, supplies and drugs. So please make a note that in developed countries like USA, UK, New Zealand, etc., health insurance plays a major role. The patient never pays money to the physician. The, the consultation fees or the surgery fees or any procedure performed by the physician or hospital, the amount is paid by the health insurance. Hence, as a provider, as a physician, he has to document everything in the medical record, and this medical record we have to assign the medical codes, and based upon the medical codes health insurance provides the reimbursement to the physicians or hospitals. Assume a physician provides treatment for 20 patients per day. Means what? 20 medical records he has to prepare and he has to assign the medical codes, and these medical codes are submitted to the health insurance. So based upon the medical codes, health insurance provides a reimbursement. So if there is no coding, there is no payment. Even as per the HIPAA law in America, every medical record has to be documented in detail in a legible manner. Every event has to be documented and must assign the medical codes. So these medical codes helps for the reimbursement and also for the purpose of statistics. Hence, every physician needs one medical coder to do the medical coding job. As I said previously, without medical coding, there is no reimbursement. So health insurance plays major role in the healthcare. Patient never pays to the physician or hospital for services. Insurance pays for all services to the providers. Hence, every encounter, every event has to be documented as per HIPAA Act and as in the medical codes. So after the medical record documentation, medical codes are submitted to the health insurance. Based upon the medical codes, insurance provides reimbursement to the providers. Without medical coding, there will be no reimbursement to physicians or hospitals. Now we discuss about the medical coding process. So first what happens here, the patient receives treatment, then physician prepares the medical record, the medical coder assigns the medical codes, and medical codes submitted to the health insurance and to the government. So generally American doctors they pay $3 to $4 per medical record for the coding to the if you do work from home. Now there are three types of codes. First one is CPT, ICD, and HCPCS. So in entire medical coding career, you have to learn about the three types of medical codes: ICD-10 CM, CPT, and HCPCS. ICD-10 CM means International Classification of Diseases, 10th Revision, Clinical Modification. ICD is used for the diagnosis coding. So approximately we have 75,000 codes. So please make a note that as a medical coder, there is no need to remember the codes. You have to refer the coding manual every time and assign the medical codes. Now you can see on the screen the sample medical codes. You can see on the right side, you can see the chest pain code is R07.4. The edema code is 12.0. Dyspnea code is R06.0. Headache code is R51. So when you get a medical record with the diagnosis of chest pain and a headache, so you assign the codes R07.4 and R51. So it all depends upon the documentation. So this is the way you have to analyze the medical record. You have to open the textbook or medical coding manual and assign the medical codes to the medical record. CPT coding. CPT means current procedural terminology. It is used for the procedures coding. So you can see on the right side of the screen, there are so many CPT codes. You have to pick up the appropriate code. For example, if you see the code 19303, it's a code for the mastectomy. And 38525, it's a biopsy of lymph nodes. 47120, hepatectomy. 45378, colonoscopy. So you have to analyze the medical record and you have to send the medical codes. For example, if the physician uh, uh, has done a colonoscopy flexible, then the code is 45378. Suppose if the surgery is hepatectomy, partial lobectomy, then the code is 47120. So as a medical coder, you have to see why patient came, what doctor has done, and assign the appropriate medical codes. HCPCS means Healthcare Common Procedural Coding System. HCPCS is used for the supplies and drugs coding. So you can see here, there's so many codes for the supplies and drugs. As I said previously, there is no need to by heart the codes. You have to refer the textbook or software. So for example, if they give an injection called injection, it's delafloxacin 1 milligram. The code is C9462. So like this, you have to refer the medical record and analyze what medication given to the patient, about the dosage, etc., and refer the HCPCS material, and you have to send the proper medical codes. So after the medical coding training, once you get the job as a medical coder, so you have to refer the medical coding manuals, or you can refer online medical coding tools, and you have to assign the medical codes. So per day, you have to assign 50 to 80 medical records per day on average. So here, initially you get the medical record from the client through electronic medical record, and then you check the information about the correctness, and you review the ICD CPT information and assign the medical codes, audit the medical codes and give to the QA team and send to the customer. So you get the medical record, check the documentation, assign the medical codes, and give to the QA, and QA submits to the client. So this is the way how medical coding is done. So assume one physician provides treatment to the 30 patients per day, means 30 medical records you have to generate, and 30 medical records has to be coded, why patient came, what doctors done, what medication is given, and all these medical codes are submitted to the physician, to the insurance company for the purpose of payment. And these medical codes not only used for the reimbursement purpose, but also used for the statistics and also for the research purpose. Now we discuss about the medical coder qualities. As a medical coder, you have to analyze the medical record, like patient details, like patient age, gender, height, weight, etc. Diagnosis, what is the chief complaint, why patient came, what is the history of present illness, what are the chronic conditions. Procedures, what procedures are performed, like lab test, X-ray, CT scan, and what medication is given, and details about the follow-up. So you have to see the medical record in 360 degrees and assign the medical codes. Now let's see some examples here. Let's say a COVID-19 example. 35 years old male came to the physician office with complaints of fever, cough, and shortness of breath, and antigen test revealed as COVID-19 positive. HRCT revealed pneumonia due to COVID-19. Now we have to assign the medical codes. Now if you see the left side of the screen, you can see some sample medical codes. Now you can see the Diagnosis is COVID-19. So the appropriate code is U07.1, that's the COVID-19, and the pneumonia code is J12.82. That's it. So refer the medical record, analyze why patient came, what doctor has done, and refer the medical coding manuals, assign the medical codes as per the manual and documentation. That's it. So let's see some of as one more example now about the procedure coding. The same patient, 35 years old patient with the fever, cough, and shortness of breath. Antigen test shown positive, and the physician performed CT chest to reveal any infection and found out pneumonia due to COVID-19. Now we have to assign the procedure codes. We can see the procedure is HRCT. So the HRCT code is 71260. So as for the documentation, we have to assign the medical codes appropriately. So medical coding process. So as a medical coder, you have to analyze the medical record, assign the diagnosis, procedure, and drug codes, refer coding books or software, and assign the medical codes. And the codes are submitted to the insurance company for the payment. Insurance reviews the codes and provides payment to the physician for services. So payment depends upon the codes. So you need to analyze, think, use medical knowledge, query physician, and then assign the proper medical codes. Types of medical coding. So every specialty requires medical coding. So you can say inpatient coding, outpatient coding, surgery coding, pathology coding, cancer coding, cardiology coding. So initially you have to prepare for the CPC exam that talks about the general coding, and with experience you can go for the specialty coding. For example, maybe of 2 years you can go for surgery coding or you can go for the cardiology coding. So specialty coders gets more salary. Generally, you will get $4 to $5 per medical record, but for specialty medical coders, they get $10 per medical record. So even if you code 10 records per day, you can make $100 per day from working from home. So it all depends upon the medical knowledge and the coding knowledge. So who are eligible? So any life science graduate, pharmacy, BDS, BAMS, BHMS, BPT, MBBS, or zoology, botany, any life science graduates are eligible for the medical coding training. As I said previously, due to COVID-19 pandemic, there are millions and billions of cases out there where medical coding is not done. So demand is huge for medical coders for next 2 to 3 years. So please don't miss the opportunity. Upgrade your career to the next level. Healthcare is a recession proof domain. So job is continuous. So there's no need to worry about the jobs. So what you are going to learn in the medical coding for next 3 months? You are going to learn about the ICD-10 coding for diagnosis, CPT coding for procedures, HCPCS coding for the supplies and drugs. We teach also medical billing and HIPAA compliance and ethics and updates. And we teach you the tips and techniques to clear the CPC exam. So the success of medical coding depends upon the how you analyze the medical record. So the entire thing depends upon the medical terminology knowledge. Because you are a B Pharma or medical student or life science graduate, you can learn terminology very fast. So the if you learn terminology properly, the medical coding is easy for you. So as a medical coding specialist, you work like a PA to the physician in America. So you get the opportunity to discuss with the doctors, patients, and insurance companies in USA. So as a medical coder, you have to have the proper communication skills, knowledge in medical terminology and medical coding. So at Medicine, we provide a comprehensive training. Will help you to clear the CPC exam. So as we discussed previously, every medical department requires medical coding because without medical coding, there is no reimbursement like pathology labs, radiology centers, surgeries, hospital, physician, everything requires a medical coding. Now you can see the RCM cycle here, that is called revenue cycle. It starts from the patient visit to the medical coding, and all medical codes submitted are used for the purpose of research and for the disease management. So at medicine, we discussed about the CPC exam. You can see that now what you have to do is you have to log into the LMS. You got a username, password to your email through My Academy. Just log into My Academy. So next step. Now, very important step is now you have to log into your LMS. Everyone got an email who are registered for the seminar. You got an email from My Academy. Check your spam folder. Log into My Academy through username password and complete the modules within 1 week. You can see approximately there are around 12 chapters are there. Go to the chapters, take the notes, refer online and take the exam. We are going to provide you the certificate of completion for a beginner's course. But if you want advanced medical coding training, you can click on the enrollment form online and enroll for the advanced training. So advanced training helps you to clear the CPC exam and to get the job internationally and nationally and also work from home. So any questions you have, please feel free to email or call Medicine. We are here to help you. You can find the details about the medicine in your training portal. You can call, WhatsApp or email and we're happy to assist you. Thank you very much.